Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for DSSSB exam preparation, that is previous year question from DSSSB exam question papers, and also we are preparing questions for CHO exam and NHM exam. All questions from previous year question paper, so surely these questions will helpful for your studies. We will see the question. First question, nerve system of the fetus is formed by options. Option A, ectoderm. Option B, endoderm. Option C, mesoderm. Option D, parenchyma. And the correct answer is option A, ectoderm. Nerve system of the fetus is formed from ectoderm. Central and peripheral nerve system, epidermis of the skin with appendages, pituitary gland, salivary gland, mucous lining of the nasal cavity, paranasal sinus, all developed from ectoderm. Okay, here correct answer is option A, ectoderm. And the next question, if a client may vomit frequently, then the client may suspect to develop options. Option A, metabolic acidosis with hyperkalemia. Option B, metabolic alkalosis with hypokalemia. Option C, metabolic acidosis with hypokalemia. And option D, metabolic alkalosis with hyperkalemia. If a client or if a patient vomit frequently, then the patient may develop metabolic alkalosis with hypokalemia. Option B is the correct answer. Due to frequent vomiting, hydrochloric acid from the gastric juice and also potassium will lose from the stomach. That may lead to metabolic alkalosis with hypokalemia. The next question, anti-infective vitamin is options. Option A, vitamin A. Option B, vitamin D. Option C, vitamin C. Option D, vitamin B. Anti-infective vitamin is vitamin A. Option A is the correct answer because it can able to fight the infections against the body. That is anti-infective vitamin. And the next question, the preferred site for bone marrow aspiration in children is option. Option A, posterior superior iliac crest. Option B, anterior superior iliac crest. Option C, posterior inferior iliac crest. And option D, anterior inferior iliac crest. Preferred site for bone marrow aspiration in children is posterior superior iliac crest. Option A is the correct answer. The next question, bluish discoloration or ecchymosis around the umbilicus is called options. Option A, Hoffman sign. Option B, Cullen sign. Option C, Osiander sign. Option D, Kerning sign. Bluish discoloration around the umbilicus is known as Cullen sign. It is mainly seen in case of hemorrhagic pancreatitis, one of the important signs in pancreatitis. And the next question, the temperature of the delivery room to be maintained warmth for neonates. Option A, 21 to 24 degrees Celsius. Option B, 25 to 28 degrees Celsius. Option C, 28 degrees Celsius to 30 degrees Celsius. Option D, above 30 degrees Celsius. Correct answer is 25 to 28 degrees Celsius. The delivery room temperature should be maintained 25 to 28 degrees Celsius. The next question, which position is given to a client after spinal anesthesia? Options, option A, Sims position. Option B, Fowler's position. Option C, flat position. Option D, supine with pillows under the head. Position preferred after spinal anesthesia is flat position. And the next question, mitral valve is also known as options. Option A, bicuspid valve. Option B, tricuspid valve. Option C, aortic valve. Option D, none of this. Mitral valve is also known as bicuspid valve. Option A is the correct answer. Bicuspid valve or left atrioventricular valve. It is located between the left atrium and ventricles. Left atrioventricular valve or bicuspid valve or mitral valve. Next question, most common type of refractive error is option A, farsightedness or hyperopia, option B, myopia or nearsightedness, option C, presbyopia, and option D, astigmatism. Most common type of refractive error is option A, farsightedness or hyperopia. Hyperopia means patient can see distant object clearly and near object he can't see properly. And the next question, most common staining technique used to distinguish between gram negative and gram positive bacteria is options. Option A, gram staining, option B, acid fast staining, option C, Schill-Nielsen staining, option D, Albert staining. The staining technique used to distinguish gram positive and gram negative bacteria is gram staining. Option A is the correct answer. Move on to the next question. U wave is seen in which of the following condition? Options. Option A, hyperkalemia, option B, hypokalemia, option C, hypotension, option D, hypertension. And the correct answer is option B, hypokalemia. In hypokalemia, there is prominent U wave we can see. Prominent U wave can see in case of hypokalemia. And also we can see ST depression, shallow, flat or inverted T wave we can see in case of hypokalemia. The next question, incubation period of rubella or German measles is options. Option A, 7 to 10 days, option B, 10 to 12 days, option C, 14 to 21 days, and option D, 10 to 15 days. Incubation period of rubella is 14 to 21 days. Option C is the correct answer. Move on to the next question. In which condition the Kramer's rule is used as a clinical assessment method in neonate? Options. Option A, neonatal hypoglycemia, option B, neonatal hyperbilirubinemia, option C, neonatal hypoxia, option D, neonatal convulsion. Kramer's rule is used as a clinical assessment method in neonatal hyperbilirubinemia. Option B is the correct answer. Kramer's rule is one of the non-invasive method to assess neonatal jaundice. The next question, what is the correct position to be maintained for a patient who shows signs of shock? Option A, supine position, option B, reverse Trendelenburg position, option C, modified Trendelenburg position, option D, lithotomy position. Correct answer is modified Trendelenburg position. Option C is the correct answer. Next question, ptosis is result from trauma to options. Option A, cranial nerve number 3, option B, cranial nerve 2, option C, cranial nerve 4, option D, cranial nerve 5. Ptosis is a result from injury to cranial nerve number 3. Option A is the correct answer. Which is cranial nerve 3? It is oculomotor. First is olfactory, second is optic, third is oculomotor nerve. Okay. So, injury to oculomotor nerve which may lead to ptosis. Ptosis means drooping of the upper eyelid. And the next question, how frequent should the nurse monitor the vital signs of the patient in the recovery room? Options. Option A, every 15 minutes. Option B, every 30 minutes. Option C, every 45 minutes. Option D, every 60 minutes. The nurse monitor the vital signs every 15 minutes in the recovery room. The next question, patient recovering from general anesthesia should be positioned in options. Option A, supine position, option B, follows position, option C, Trendelenburg position, option D, side lying position. After general anesthesia, we should give side lying position to the patient. After spinal anesthesia, we should provide flat position. General anesthesia, side lying position. Option D is the correct answer. The next question, which part of the tongue senses sweetness? Options: option A, anterior part of the tongue, option B, posterior part of the tongue, option C, lateral part of the tongue, and option D, none of this. Sweetness is tasted by anterior part of the tongue. Option A is the correct answer. Bitterness is tasted by posterior part of the tongue, and salty or sourness is feeling in the lateral part of the tongue. And the next question, double bubble sign is the characteristic sign of which disease? Option A, intussusception, option B, pyloric stenosis, option D, duodenal atresia, option D, duodenal ulcer. Double bubble sign is the characteristic sign of duodenal atresia. Option C is the correct answer. Move on to the next question. Initially, the mother should feed the baby at least. Options: option A, 3 times a day, option B, 5 to 6 times a day, option C, 8 to 12 times a day, and option D, 10 to 16 times a day. Initially, that is at first, the mother should feed the baby at least 8 to 12 times a day. Option C is the correct answer.